The provider payment tool is a one-of-a-kind tool that shows how payments made to doctors and other healthcare providers vary across the state. This information, produced by CIVHC and based on claims data in the Colorado All-Payer Claims Database, can be used by consumers and employers to understand reasonable costs for healthcare services and can be used by payers and providers to benchmark their payments. Additionally, state agencies, researchers, and policymakers can use the tool to understand payment variation across the state and identify ways to make healthcare more affordable. The tool is available on the civhc.org website, and the page contains additional information detailing methodology and use case examples. The interactive report includes 2 tabs: procedures that get paid to non-anesthesia providers and payments for procedures to anesthesia providers. On each tab, there are instructions to refer to, and there are a number of different filters available that enable you to select the information that's most relevant to you. On the non-anesthesia tab, first, you select a year from 2018 to the most current year. Then, you select the payer type you're most interested in: commercial payers, Medicaid, Medicare Advantage, or Medicare fee-for-service. Next, you select where the procedure or service might take place: either inpatient, which requires a hospital overnight stay, or an outpatient setting, which doesn't require a hospital overnight stay. This is followed by selecting where in the state the service will or did take place. The user is able to choose between looking at the data statewide, or by county, or by division of insurance rate setting region. If you select either county or DOI region, you must select one of the corresponding options in the next filter to populate the results. In this instance, let's select Denver County. Lastly, you can choose from a variety of provider types and settings. The default selection is for specialists and general practitioners, but you can also choose from a long list that includes lab providers, pharmacists, dentists, and behavioral health and social service providers. If you know the specific code you want results for, you can type it into the box directly below the filters. Otherwise, you can leave it blank and all of the codes available for your selection will appear. With the selections we've made, we get results for all of the codes available that had at least 30 claims in the Colorado All-Payer Claims Database. The output gives you the specific code and name, identifies whether it was paid for on a flat fee schedule or if it usually depends on a unit of measurement, such as how many minutes were involved, and gives you a number of payments, including the average payment, the median or 50th percentile payment, the 60th percentile payment, which is used for the basis of the majority of out-of-network payment limits, and the low and high-end payments, which are represented as the 25th and 75th percentile payments. The payments represent total allowed amounts, which include what insurance payers and patients paid for the service combined. When viewing the payments, be aware that the average payment can be influenced by very high or very low end payments, while the median payment represents the middle payment is not impacted by low or high payments. It is also important to note that some codes do not have sufficient volume to be displayed for some counties and regions. If you have selected a county like Denver and you see a D by the code description, this means that for that code, volume was too low for Denver County, so the data is showing the next smallest geography available, which for this instance is the DOI region that includes Denver. If you see an S by the code, that means that it is displaying statewide data, and both county level and DOI region data did not have sufficient claims volume to be displayed. For the anesthesia tab, the same filters are available at the top that are available on the first tab. Anesthesia payments are more complicated, however, so on this tab, you have to select additional information to calculate payments for providers. First, you select the specific anesthesia code from the drop-down menu. For this example, we'll select 216, which is anesthesia procedure for a procedure on blood vessels in the brain. Second, you need to indicate the physical status of the patient. There's a reference guide for physical status in the table below. In this instance, we'll leave it as P1, which indicates a normal, healthy patient. Next, you select a modifier, which reflects the anesthesia provider who was involved. And in this case, we'll select QX, which indicates it was a non-physician anesthetist that was under medical direction of a physician. Lastly, you'll need to enter how long the procedure is estimated to take, with 1 equaling 15 minutes. In our example, let's enter 4 to estimate that it will take 1 hour to perform the procedure. The results show the conversion factor, which is the payment estimated from the COAPCD data, and the calculated reimbursement rates display similar ranges in payments as the first tab at the 25th, 50th, 60th, and 75th percentile. For our selection statewide, it's estimated that commercial payers and patients pay $709 for this procedure on the low end and $1,145 on the high end. In general, the provider payment tool can help answer questions like how much are providers typically paid for a 45-minute therapy session, and have payments by different payers changed since 2018? Do commercial payments for office visits vary for different provider types? And what do anesthesiologists in Arapahoe County get paid to perform a 45-minute inpatient appendectomy on a healthy patient? There are many more use cases for this tool, and Civic also has a Shop for Care tool that has named hospital and facility prices for common imaging procedures and other procedures such as knee surgery and deliveries. We also offer custom non-public analysis for a licensing fee if you don't find what you're looking for in our publicly reported data. To learn more about this report or other services we offer, please contact us at info@civic.org.